Hello everyone, this is Dr. Garima Sachdeva, and today we are going to discuss important exam tested concepts regarding laparoscopy associated injury, and I'll also be sharing the related references regarding our discussion. So in case if you get a question, which is the most common organ to be injured during laparoscopic surgeries? So then your answer would be bowel injuries. So as you can see, this is from GTG 49, which was released in 2008. According to it, the incidence of bowel injury is 0.6 in 1,000, urological injury it is 0.3 in 1,000, and vascular it is 0.1 in 1,000. Okay. So if they ask you which is the most common organ to be injured during laparoscopy surgery, it will be bowel, and overall major complications associated with laparoscopy is 1.4 in 1,000. The next possible question which you can get regarding this would be about most common cause of death following laparoscopy surgery. So in this case, your answer would be anesthetic complications, and the second most common cause is vascular complications. The reference for this is from the TOG, which is vascular injuries associated with laparoscopic gynecological surgeries. So again, to repeat, most common cause of death following laparoscopy, the most common reason is anesthetic complications, and the second most common reason is vascular complications. I hope I'm clear. And the next possible question which you can get on this could be the most common major complication associated with laparoscopic pelvic surgeries. So this is about major complication with laparoscopic pelvic surgeries. Then your answer will be urinary tract injuries, and the reference to is from the TOG released in 2013, which is about urinary tract injuries in laparoscopic gynecological surgery, prevention, recognition and management. So again, to repeat, if you get a question, most common type of major complication of laparoscopic pelvic surgery, then your answer would be urinary tract injuries. I hope this makes sense. So now, in continuation to the previous thing which we studied about the major complication associated with laparoscopic pelvic surgery, we studied that it is urinary tract injury. Now, amongst the pelvic surgeries, if they give you specifically, like if they give you what is the most common organ to be injured post laparoscopy assisted vaginal hysterectomy, then your answer will be bladder. And in case if they ask you which is the most common structure to be injured with laparoscopy hysterectomy, then or with total laparoscopic hysterectomy, most common structure to be injured is ureter. So again, to repeat, with laparoscopy assisted vaginal hysterectomy, most common organ to be injured is bladder, and with laparoscopy hysterectomy, the most common structure to be injured is ureter. I hope this makes some sense. Then important questions specific to bladder injury that can be asked from the stock article could be the first one, which I already told you, which is the most common visceral injury related to laparoscopic pelvic surgery. Then the answer would be bladder injury. The incidence of bladder injury ranges from 0.02 to 8.3%. And if they ask you what is the most common step which can lead to this bladder injury, it would be during dissection of bladder from the cervix. And this is very, very important, that only 50% of bladder injury are recognized intraoperatively, which means that half of the bladder injuries are actually missed during the operation. Then the next thing that they can ask you would be about the most common site of bladder injury. So that would be midline above the intertrochanteric bar or midline above the interureteric bar. Then other things could be about the risk factors of urinary tract injury. It would be endometriosis, cancer, anything which causes adhesions, obesity, or if it is pregnancy. So these are some important questions from the talk that could be asked about urinary bladder injury. Now coming to important questions that could be asked about ureteric injury related to the given talk. The incidence of ureteric injury, it is less than 1 to 2%. However, if they give you specifically that how much is the rise of the ureteric injury if laparoscopic surgery is being done for deep infiltrating endometriosis, then your answer will be 21%. Then what is the most common site of ureteric injury? It is at the pelvic brim and lateral to the cervix. Again, a very important question, that only 33% or only 1/3 of the ureteric injuries are recognized intraoperatively, which means that 2/3 of the ureteric injuries are actually missed intraoperatively. Then, what is the most common ureteric injury? It is transection. Other types of ureteric injuries include angulation, crush injury, ligation, thermal injury, laceration, or resection. So this was all about the important questions that can be asked in your exam. I hope this was useful. Thank you so much for your time.